My name is Charlie Salibi, and I'm a psychiatric mental health nurse practitioner student at Eastern Kentucky University. Today I'm going to be talking about my project looking at web-based cognitive behavioral therapy treatment for substance abuse patients and looking at how it can prolong abstinence when compared to treatment as usual. Our country is facing an opioid epidemic, our state especially. In 2016, there were 989 opioid-related deaths in Kentucky alone. That's at a rate of 23.6 deaths per 100,000. That's nearly double the national rate. Kentucky is in the top 10 states for opioid abuse. And every day, 115 Americans at least die from substance abuse. Regardless if you're a psychiatric mental health nurse practitioner student or if you're a family practitioner student, odds are at one point or another we will all come across this problem in our practice. The objective of my project is to determine if combining cognitive behavioral therapy via a web-based program will help patients recovering from substance abuse by helping them to maintain abstinence longer than treatment as usual. Ideally, the CBT program would be easier to access for patients. It would be a program that patients can use from anywhere, and it could also be used as a bridge between therapy appointments when patients just need to touch base with someone. They need to feel connected to their recovery. If they're having a bad day, this would be a program that they could log on to from anywhere and get some tips or advice they need about making sure that they are successful in their recovery. Lots of background and research work has already been done looking at substance abuse. I found 4 level 2 studies and did reviews on those studies, and they all showed positive outcomes when looking at web-based cognitive behavioral therapy. In 2014, Campbell did a study that found that patients receiving web-based training had more consecutive weeks of abstinence versus treatment as usual. Again, in 2013, Marsh found that there was a greater percentage of overall weeks of abstinence in the cognitive behavioral therapy group that they looked at. Killock and Carroll have also done studies that I reviewed, and in both of those studies, when looking at cognitive behavioral therapy and web-based training, patients in those programs versus patients in already established programs that continue treatment as usual, those groups as well had longer periods of abstinence and longer weeks of being drug-free. So after looking at these reviews, I came up with a plan to develop my own project that would look at a 12-week trial of cognitive behavioral therapy. This would take place at the Beaumont Behavioral Health Clinic in Lexington, Kentucky. I would use patients who volunteered for the project only. For a couple months prior to the study, I would place flyers at the clinic and invite patients who were interested to be a part of my study. The inclusion for this study would be they have to have a history of opioid dependence, 18 years of age or older. It would be on a volunteer sign-up basis only, and they would have to have internet access at home since this is a web-based program, and established substance abuse therapy at the Beaumont Behavioral Health Clinic. Exclusion would be under 18 years of age, no internet access, not currently an established patient at the Beaumont Behavioral Health Clinic for substance abuse. For my project, I wanted to take at least 30 participants. And like I said, again, it would be on a volunteer basis only. We would go over informed consent with those patients before kicking off the 12-week project. For 12 weeks, we would have the patients come in once per week for their routine therapy, and then for 1 hour per week at any time during that week, the patients could log on to the CBT program online and complete 1 hour of web-based training. At their weekly appointment with their already established provider, we would do a urine drug screen and make sure that those patients are maintaining abstinence. After the 12-week program, we would follow up with patients at the 6-week post-study just for an interview just to ask them, what they thought about the study, room for improvement, was it feasible for substance abuse patients to actually complete this project, and if they thought it was helpful. It's so important to talk to our patients and make sure that what we're doing is actually working for them. And sometimes the patients can be the best people who give us that insight that we may not be able to have from the other side to tell us what we can do better. So this project should ideally show that these patients with the CBT training show longer periods of abstinence. We would measure length of weeks of abstinence to measure our outcomes. The urine drug screen would also be used as a tool just to confirm abstinence. And we would also monitor the weekly use of the CBT program to ensure that the volunteers are actually completing that online training and that that is making an impact. Substance abuse is on the rise. It is vital that nurse practitioners are prepared for dealing with substance abuse. We are at a place where we need to be able to provide flexible, affordable, evidence-based practice interventions that work. We have to turn things around. While more research still needs to be done to confirm the long-term effects of cognitive behavioral therapy, I think this is a great place to start. We have to start somewhere, and we all need to be prepared to address this problem. My name is Charlie Salibi. If you have any questions about my project, you can email me at charlie.brown@uky.edu. Thank you so much for listening today.